My name is Will Story. I'm an assistant professor in the Department of Community and Behavioral Health here at the University of Iowa's College of Public Health. So I got into this field actually back right after my undergrad. I went to China for a year and had the opportunity to teach English there. And one of the things I was not expecting was it being exposed to global health really for the first time. So I had the opportunity to sort of, for the first time, connect what social determinants were for health. So I saw poverty, lack of education, rurality as well being sort of indicators of health. And although I didn't really know it at the time, I saw that as something that was sort of the actual health effects of those different areas. So I came back not knowing really what to do with that information. I knew I wanted to make a difference, but what could I do? So I looked into different schools of public health and went on to get my master's in public health at the University of Michigan, where I was studying global public health, which was then called international health. And so I got my degree after a few years and then started working with an NGO that is a member of the core group called World Renew. I worked for World Renew for about 5 years on child survival projects, malaria, HIV, and really had the opportunity to learn how development and health, global health, is done well through that organization. That organization is still and was a member of the core group, and so by being a member of the core group, I was the co-chair of the Social and Behavior Change Working Group. I also had the opportunity to serve on the board of directors there, and through talking with colleagues both in the core group and at my organization at World Renew, we kept stumbling upon questions about the way that communities and community-based interventions really have an impact on health. And how can we prove that a community-based approach may be actually a more sustainable and more effective approach compared to other approaches? It was sort of that level of inquiry that led me to my next steps. So I came to work here at the University of Iowa with sort of following on those questions I was just talking about of trying to understand why community-based approaches are more effective. I went on to actually leave World Renew and got my PhD. So I pursued a doctorate, both because I wanted to pursue those questions in more depth, but also because I wanted to teach again and have that opportunity. So I did my PhD and studied mainly social capital and how social capital can be used as a resource by communities to improve their access to health care, and trying to better understand how that construct is measured in communities. And after finishing there, I actually went to the Carolina Population Center at the University of Carolina in Chapel Hill. And there I continued to build relationships and explore these questions, both related to building stronger families and stronger communities and having more of an evaluative lens, so how to evaluate programs that are doing that. And then that's when the University of Iowa came in. As I finished that postdoc and had the opportunity to come here as an assistant professor, it was really a perfect fit. I'm in the Department of Community and Behavioral Health, which really couldn't be a better title for the type of work that I do. And so being here just seems to be like a good environment to explore a lot of those questions. So the most rewarding part of what I do, I think I'd have to say, is twofold. One is teaching students and seeing them to be inspired to pursue a career in global public health and work in partnership with communities and do it the right way. That's one. The other is, through my research, being able to partner with NGOs. So being able to partner with organizations that are on the ground doing the work, and being able to bring sort of an evaluative lens to the work that they're doing, or maybe an operations or implementation research perspective, to better understand what they're doing, why it's working, and how it can be scaled up. So the University of Iowa's College of Public Health, one of the biggest strengths that we really bring to global health, I think, is in the rigor of our methodological approach. So we're really well known for both injury and violence prevention. We do a lot of work with environmental exposures and how that can impact health, especially maternal and child health, water, sanitation, hygiene interventions, and obviously community-based approaches to health promotion. So those are some of the core areas of our expertise, and bringing sort of methodological rigor to how you measure that and evaluate whether or not programs are having the intended impact. So I think that's one way in order to make sure that we're building that evidence base for these different approaches. The other thing that I think that we really bring to the table here is by partnering with organizations, like non-governmental organizations who want to partner together with us, not only to build in that rigor, but then to move the evidence base forward by bringing that evidence to the peer-reviewed literature. And so it's one of our sort of objectives as faculty here to be able to get this evidence base in the peer-reviewed literature, so then we can start to better understand and build on and create this knowledge base that people can then build on in their own work. So it can impact different interventions and projects and programs moving forward as we start to build that evidence base. So our goal is not only to sort of lend that methodological rigor, but then to build the evidence base through peer-reviewed publications. I'd say the biggest challenges that we have yet to overcome in global health, one I think is obviously biased by my own research, is sort of understanding the complexities of family and societal relationships, that our individual health behaviors do not happen in a vacuum. That people all around us are influencing us. We're influenced by our cultural and social norms. And it's important to understand that that's a reality, and it can be measured. So understanding how do we put a metric to social and normative change? How can we understand whether or not that's changing over time? And what are the most effective ways to produce that change? So I think that moving forward, both in sort of in academia where we are, as well as NGOs moving forward, we want to be able to build that evidence to show what are the most effective ways to start to see social change, and can we start to measure that so that then we can build that evidence and be able to scale it up.